Hi, it's Dr. Jason Schmidt with Vance Thompson Vision in Alexandria, Minnesota. And so I'm talking to you today about refractive lens exchange. It's where you take the lens out of your eye and put in a new lens to allow you to see both distance and near. I had this done actually about 2 years ago, 2.5 years ago. And one of the misnomers is that if you've had LASIK surgery in the past that you can't have any other procedures. Well, I had LASIK in the past as well. I had LASIK probably 25 years ago, and my distance vision has been great. But then as I got older, I started to lose my near vision, so I was needing reading glasses. So I tried reading glasses. I tried doing eye drops that help with focusing again. Some people like to do what's called monovision, where you wear a contact lens on one eye for near and keep the other eye for distance. None of that really worked for me. So I chose a refractive lens exchange that allows me the freedom of no glasses. So here I am. I can see far away, I can see up close, I can see my watch, I can see my phone, I can see the computer. There isn't a distance I can't see. It's all seamless. And when you do an elective procedure, I had both eyes done the same day. So within 10-minute surgery, both eyes corrected. I ended up using eye drops for 2 weeks afterwards. Very next day, I came in, I was seeing great. I went out for breakfast and I was reading the menu. When we went out for breakfast, it was amazing. When you look at lights at first, you can see some glow around lights, headlights, street lights. And I tell patients to look at that now because you already have tuned that out over time. Lights have a natural glow around them, but the way this lens works, there is a little bit of a glow around lights at first, which gradually fades with time. And I noticed that initially for a couple months, but it faded with time. And then I also had a YAG procedure just on my right eye, I believe, several months ago. Anybody that has cataract surgery, there's a chance of getting a film on the back of the lens capsule, and when that happens, it can blur your vision up a little bit. And I felt that my left eye was a little fuzzy, so we did a 10-second laser, cleared that up. I see great. So I highly, highly encourage people to consider a refractive lens exchange. It allows you the freedom of no glasses. I chose to do it early so I could enjoy the benefits as long as possible. This lasts forever. So I'll hopefully have another 50 years of no glasses. If you have any questions about that, please contact your eye doctor or give us a call here at Vance Thompson Vision. Thank you.